Shalom and welcome to 2 Minutes of Torah. This year is in Taharat Daf Yomi Yevamot Samachet Ahmed Aleph. We are continuing our discussion with a woman married to a Kohain, an Aishet Kohain, and she is pregnant. We saw in the previous year that there may be an issue with her entering a cemetery or going to any place for that matter, where there's a tum'ah, a hospital where someone died. Just like a Kohen cannot go into a hospital, unless it's pikuach nefesh, if there's someone dead. So to Aishet Kohain, maybe there should be a problem. The boy might, the child might be his son, and there's an isser of chinuch, bring him to a place of isser. We saw the rokeach who maintains the sfeik, a double suffix. Now the question is that if the whole head there is that there's a sfeik, maybe chas v'shalom, the baby's not a viable baby, known as a nafel, and even if a baby's a viable baby, maybe a female. Well, what about ultrasound nowadays? Where now there's ultrasound, and the doctor says it's a boy. It's going to be a boy. So the post will discuss this question. It's an interesting shaila because now we don't have a sfeik, a double suffix. We only have one suffix. The suffix is whether the baby's viable or not, but we know the baby's a boy. Even the idea, the suffix of a baby being viable or not is an interesting shaila because most babies, Baruch Hashem, are born healthy. So the fact is, it's not a simple question. And there's a svara to say that a woman who has an ultrasound and knows that the baby's a boy, maybe she should be careful with halachot of tumah and not go into a cemetery. As the Mishnah Berurah says, that the only head is because of sfeik. There's a side to say that. A side that may be mutar would be that it's not 100% to say there's no suffix. It's not simple. Sometimes the doctors do make mistakes, and maybe there is still sfeik. Then what if a person is a mumcha and really doesn't make mistakes in this area? Hardly ever. Is it still legitimate to consider it a suffix? So those poskim that say that really it's not such a strong sfeik anymore, it's really not a sfeik because the doctor's knowledge, based on his understanding of the ultrasound, and therefore it would be best if she knows that it's a boy not to enter a cemetery and to avoid a hospital where someone died. The poskim do mention that if there is a concern for her health, of course, then she could go into any hospital that she deems fit and appropriate. And because, of course, a pregnant woman, we are machal Shabbos. So even if she was going to be careful and only look at herself as one suffix, and therefore not go into a cemetery, not go into hospital stam, of course, as any kind of suffix, pikuach nefesh, for her own sake, she wants to give birth dafka in this hospital, as opposed to another hospital where there's less chance is going to be a mace, then she should do what she wants to do, because it's important that she has her mental health and that she feels stable. There are those that say that it's best not to have an ultrasound, for Aishet Kohain not to have an ultrasound, so in that way, she have an ultrasound but not know what the status of the baby is, and therefore she still has a sfeik like any other woman. Of course, in each case, a woman has to discuss the shaila with her Rav. Shalom.